Bismillahirrahmanirrahim. Welcome to all the participants for our infection prevention and control course for the year 2023. First of all, I'd like to introduce myself. My name is Junaida. I'm a medical doctor by profession and I've also done my PhD in public health from University of Edinburgh. I've been a public health practitioner for half of my life and I'm also a mother of three. I like to think of myself multi-dexterous person because I know the clinical aspect as well as the public health aspect of medicine. The session outlines I'd like to tell you, and they also have the timeline. We would go through other basic concepts. So we assume that you have some knowledge of infection prevention and control, but we would still like to refresh it. And that's why we are going to go through some of the core components. And I would like to emphasize that this session is important because the rest of the sessions are going to build on this session. So if we touch upon the core components, we touch upon the significance and impact of the IPC practices, and of course the IPC program as a core component. So there are 8 components and IPC program is the first component. So we'll look at that first component in detail. For the next hour, we'll go through the multimodal strategies. That's one of a very important pillar in this whole concept of infection prevention and control, and I'd like to be familiar with this concept early on so that you can take it along with you for the rest of the course. The last 30 minutes would be for a tool that's a very good resource that we're going to share with you, and that tool we would not only like to share the tool with you, but you would do it as hands-on practice as well. So that's as far as the outline of this session is concerned. As we start this session, I would like you to go through the learning objectives one by one, and these learning objectives would come one by one in the next duration of 3 or so hours. So what we expect from you are that by the end of the module, you should be able to understand the concept of infection prevention and control. You should be able to comprehend the significance of IPC and the related investment. You should be able to appreciate the impact of the IPC practices, enumerate the 8 components, differentiate between the minimum standards and the full standards, discuss the global strategies, and appreciate the challenges faced by the healthcare facilities. We would also like you to administer IPCAF for baseline review of the healthcare facilities. So this seems like a tall order, but I assure you that by the end of the 3 hours, you'd be very comfortable with this. So starting off with what is IPC, I assume I've started at the very baseline, starting from scratch, assuming as if my audience doesn't know much. So bear with me. And IPC is, of course, infection prevention and control. So throughout the session, whenever I say IPC, I mean infection prevention and control. So it's described as a clinical and public health specialty. So you'd be surprised to see that it's a specialty and it comprises both the clinical aspect as well as the public health aspect. And it's based on a practical and evidence-based approach. Basically, what it does is it protects the patients, it protects the health workers, and it protects the visitors that come to the healthcare facilities. So it's very, very important because normally when we say that it has everything to do with the patient safety, we forget about the healthcare workers. So it's very important. I've underlined these 3, that these 3 are equally important stakeholders. How does IPC do that? IPC does that by preventing avoidable infections, including those caused by the antimicrobial resistant pathogens and acquired during the provision of healthcare services. So that's why the importance of IPC cannot be undermined at all. And it's a very cross-cutting theme. So there's no specialty within hospital that can say that we don't come in the purview of infection prevention and control. So because it's cross-cutting, that's why we all need to team up to work toward. This is a diagram that you might see a lot whenever you scroll down on the internet for IPC. And what does this diagram show is what I said a few minutes ago, and that was that this is a cross-cutting theme. So we need to work as a team because there are lots of things that go together. You can see the branches of this tree, and the tree, if you consider the tree as infection prevention and control, there are so many different things that can guide us towards this infection prevention and control. And if we forget one, or if we forget more than one, that we cannot reach our objectives. You can go through these at layer, and a few of them we'll discuss in this session also later on. So the general concepts of infection prevention and control, the latest milestone that you need to be aware of is the meeting of the World Health Assembly that took place in May 2022, so about a year ago. And it approved a global strategy on infection prevention and control. So I think that these kind of things, these kind of landmarks are very, very important because they show that people around the world have a commitment towards IPC. And because of this, IPC is positioned as central to infection hazard and central to health emergency preparedness and response. We'll talk about health emergency preparedness and response later on as well, so I'm not going in detail at this point in time. IPC is recognized as a key to addressing the silent burden, and when I say silent, I mean that it has not been recognized, and it is usually people kind of neglect this. So it's a silent burden of healthcare associated infections, normally called HAIs, and antimicrobial resistance, which is called AMR. So whenever I say HAI, I mean healthcare associated infections, which are usually those infections which people acquire while staying at a healthcare facility. And those people can be patients, they can be healthcare providers, or they can be visitors visiting the healthcare facilities. So the World Health Assembly made sure that infection prevention and control was addressed in the context of healthcare system. So you see, I cannot stress more that context is very, very important. Context is like a frame to a picture. So picture can be emphasized with a frame, or picture can be made more prominent with the help of a frame. So the health system strengthening is core to IPC. You cannot expect infection prevention and control with a weak health system. That's why health system strengthening would come again and again in the different core components. The second thing is high care healthcare delivery. So high quality. The thing is that high quality healthcare delivery is not possible if there is no infection prevention and control. And you would agree with me on that. The aim is to improve patient and health worker safety. So we are all aiming, the bigger aim that we are going for is a safety culture, and IPC is very much part of it. As I go on, I cannot stress more about how important IPC is. As you can see in the slide, the significance of IPC is manifold. It occupies a unique position in the field of patient and health worker safety, and it also occupies a unique position in the quality of care. So this is something that has been acknowledged universally. And because there's going to be an interaction between the healthcare worker, between the patient, and between the visitor and the patient also, so all three are important stakeholders. You would agree with me that COVID-19 has brought this thing more into limelight because the infection prevention and control was the main thing that broke the chain of infections as far as COVID-19 was concerned. And unless and until we worked on infection prevention and control, we were not able to have a hand on the COVID-19 epidemic. So the positive thing, I always say that all negative things have a positive, all clouds have a silver lining. So the positive impact from this epidemic was that it exposed many challenges and gaps within our health system, but then it provided us with an opportunity as well. So that opportunity, we need to seize this opportunity. And one of the things that we need to work on is our infection prevention and control programs. So all countries, it was stressed at the World Health Assembly that all countries must be enabled to allocate human resources, supplies, and infrastructure for this requirement. The thing is that the human resources and supplies and infrastructure are very, very important, and these important things, they have been highlighted, these three, because without these three, the infection prevention and control strategies cannot be put in place. If you look at this diagram, there are 5 main reasons for investing in IPC. I included this slide because usually you have people who are working as subordinates to you, or you have people working at higher ups or at the policy level. So you might need to advocate, or it's very useful for advocacy to the policymaker. And it's also very useful for people working under you as subordinates, because unless and until they are convinced, they cannot change their behaviors. And if they cannot change their behaviors, all the strategy for IPC cannot succeed. No matter how many supplies, no matter how many infrastructure, if the human behavior cannot be changed, then we cannot improve the IPC at all. This slide that's in front of you shows the 5 main reasons why we should invest in IPC, because even for very well developed countries, the resources are limited, and those limited resources mean that we have to make very good choices. So how do we prioritize IPC within those choices? This slide shows us that. So if we invest in IPC, we ensure quality of care and patient health workers' safety. I've discussed this earlier on quite a few times. The second thing is it directly improves the health outcomes. So what do we mean by that? The health outcomes are, for example, a patient comes to a hospital for treatment. That patient should not go back home with another infection. So that's something that we are morally and legally bound that it should not happen. So with IPC, better IPC control in place, we ensure that the health outcomes are better, good for the patient. The third thing is it reduces the healthcare costs and the out-of-pocket expenses. So that whatever I've included in this slide is based on evidence. So it's not anecdotal, it's not something that I am saying, it's something that is backed by evidence, and you can go through your own literature and you can say that you can also see that healthcare costs are markedly reduced if you work on IPC, if you have investment there. The fourth thing is that there are proven strategies which can be implemented. So that's a good thing. Sometimes we advise things, but we are not sure how to do them. But that's not the case with IPC. So in IPC, we do have proven strategies, and those proven strategies can be implemented. The fifth thing why we should invest is it's a scalable and adaptable strategy. By scalable, I mean you can take it up as much as you want, and you can bring it down as much as you want. So it depends. The excuse that I don't have enough resources doesn't work here. So you can modify it, you can tailor it according to the resources that you have. As you would see, the world is full of different kinds of countries, and we have different kinds of resources, we have different priorities as well. So that excuse does not enter why we should not invest in IPC. It can be tailored to our resource. In this slide, I've deliberately included this slide because it tells the difference between preparedness, readiness, and response. Usually we use these 3 words interchangeably, and that doesn't work. So whenever we say preparedness, this is well before the onset of an epidemic, and as before as 2 years. So as the COVID-19 epidemic told us that we were not prepared. So the reason was because we thought that these slides, this kind of epidemic would not hit us. So we were not prepared for that. But now that it has happened, all the systems are geared towards bringing about change, and they know the gaps, and they are trying to be prepared for any impending disaster that's coming later on, might, God forbid, come. So preparedness is well before the onset of the problem. Readiness is when it is, we are quite facing it, or it's very much near, or it has actually happened. So that's all the strategies, all the things that we do at that point in time are included in our readiness. And the third thing is response. So response is once it has happened, it's ongoing. So all the steps that we take while an event or has happened would be included in that. So it's just a differentiation about the same thing, but the timeline is important. So we need all these 3 together, but the aspect and the way we need to deal with these are the strategies that we need to use are different. So because preparedness is for the previous 2 years, the strategies are different. Readiness is when it's impending or it's right in front of us, and response is when it has actually happened. What are the potential impacts of IPC practices? So once we are sure, up till now what we have done is we know that infection prevention and control is central to all the healthcare practices. We know that patients are not the only stakeholders. There are patients, there are providers, and there are visitors also that comes to the healthcare facility. number two. Number three that we know is that this kind of investment is worth it because there are so many advantages. And number four is we also know that the World Health Assembly a year ago brought this up in the agenda. So it was already there, but it brought it up in the agenda. It's now prioritized. What we see now is the fifth thing that we see are the potential impact of the IPC practices. So out of every 100 patients, it has been estimated that 7 patients in high income and 15 patients in low income countries. So I'd like to highlight the gap also, high income countries 7% and in the low income countries 15% of people, they undergo they acquire at least one healthcare associated infection, at least one during their hospital stay. And I think that's very, very unfair because that points to a disparity. And as healthcare professionals, as public health professionals, we need to work to reduce these disparities. So even there are two things that are highlighted here. One thing is that even high income countries are unable to control this IPC. It's not as if their 100% patients are free. So they need to adopt some strategy as well. But as low income countries or developing countries, we need to work more because we are more affected, kind of double affected than the high income country. On average, so if we don't segregate, on average 1 in every 10 patients will die from a hospital acquired infection, and I think that's again very, very unacceptable. It's more to do with people who have reduced immunity or people who are at a certain stage of life, for example the newborns, or people who are immunocompromised. For example, they could be in intensive care, or they could be they could have a certain disease that reduces their immunity. So they are more at risk for infections, hospital-acquired infections. It's also been seen that 1 in 4 hospital-treated sepsis cases and almost half of all cases of sepsis are healthcare associated. So I think being a healthcare provider myself, this is something that cannot be justified, that how a patient who comes for health to a healthcare facility gets another infection which might take that person's life. I think that's enough driving force for us to do something about it. But there's good news also. So the good news is that good hand hygiene, and they're very cost effective strategies as well. So those two things can reduce 70% of these infections. So I think that's a very that's an opportunity that we need to seize, and that's something that should be adopted by all of us because, like we say, the dividends are very high. So increased investment in IPC can improve the health outcomes, like we said earlier, and reduce the healthcare costs. As a developing country, we need to reduce the costs and we need to improve the healthcare outcomes also. So all the more reason for us to invest in infection prevention practices. One other thing that's highlighted here is the out-of-pocket expenses. So there are countries who bear all the health costs for the ill patients or for the sick patients. All the cost is borne by the state. And then there are countries in which most of the cost of health is borne by the person or the families, which is called out-of-pocket expenses. So if we reduce the hospital-acquired infections or their prevalence, then we can expect this cost to come down as well. And we know from evidence that this cost is something that can be catastrophic, which means that it can be life-threatening for people, or it can threaten their livelihoods, or it can take up all the money that they have, and they have to have loan also for that. And so their own quality of life is compromised. Coming to the next learning objective. If you remember that one of the learning objectives was that you would be familiarized with the 8 core components of IPC. Being in your position not very far ago, I've been a student for more than half my life. I still consider myself a student. If I give you a list of 8 things, it's very difficult for you to memorize that or to recognize that. I think this diagram makes it very easy. And the reason why this diagram makes it easy is because it puts things in perspective. So the way it's done in this diagram is, number one, if you see that there are three sections in the inner circle, and then there's an outer circle as well. So going to first looking at the orange one, which is the first core component, it is the IPC program and all the relevant program linkages. So that's the first core component of infection prevention and control, that a program should be in place. The second thing is, a program cannot work in isolation, so we need guidelines. And why do we need guidelines? You'll see in the next slides. But the thing is that these guidelines ensure that all of us work the same way, and they guide us. So they are the guiding light for all the activities that take place. So that's the second component. The first one is the program. The second one is the guidelines. The third one is education and training. So we cannot emphasize this more. Why? Because that's how we give these guidelines to all the workers and all the stakeholders. So unless and until we train them, unless and until we educate them, this the IPC cannot be cross-cutting. Everybody would not be using it. So that's the third component. The fourth component is surveillance. I'm not going to go into detail because there's a separate session on surveillance here. But the surveillance is something which is ongoing throughout. So it's not something that you do today and you forget about tomorrow. That's one thing. The other thing is, the data from surveillance is so important because it helps us in decision making also, all kinds of decision making. So these two elements of surveillance, one, that it is ongoing, and the second, that it is the data, it provides very useful, very precious data that we can use later on. So these are the two things that make it a very important component. The fifth component is the monitoring, audit, and feedback. It's somehow related to surveillance, but it's a different thing because it is used by the management, and we'll have a separate session on that. So I'm only familiarizing you with this as a component of IPC. So like I said, this circle helps you memorize these 8 components. So we have done 5 at the moment. One of them is the IPC program. The other 4 are in the blue slide. The next thing that you need to see is the outer circle, and that is the multimodal strategy. So the outer circle shows the multimodal strategies, and what are they? We are going to see in the next slide. But this term multimodal strategies is very important, and I would like you to keep in mind that this is the core component on which the rest of them are based. So like you see in the slide, it encompasses everything. So it's a circle within which the rest of the components are. So that just shows it's important, and it shows that it is related to all the components. Last of all are the enabling environments. I'd like you to see the arrows as well, in this diagram. Focus on the arrows as well, the direction of the arrows. So unless and until there's an enabling environment, we cannot expect the rest of the core components to work. So the enabling environment includes the workload, staffing, and the bed occupancy. So those of you who already work in hospital settings would agree with me how important this is, because the workload sometimes makes IPC impossible. Same is the case with staffing, and same is the case with the bed occupancy. So there are countries, I won't name them, but there are countries which cannot even afford a single patient on a bed. So more than one patients occupy the same bed. So how can you expect IPC to work in those settings? So all these things need to be kept in mind if we want to work on infection prevention and control. The last of all is the built environment. Because I've worked in clinical settings as well, and I've worked in very resource poor settings as well. So if there's no place to wash hands, hand washing is very basic. So if there's no place to wash hands, or if there's no facility to wash hands as often as I like, then I cannot expect infection prevention and control to work. Those things are part of the built environment, and those things are part of the enabling environment. So all these 8 components work in tandem. For those of you who are not familiar with the word tandem, tandem is the bicycle which 2 people can ride, if you've seen that. So in that bicycle, those two have to pedal in the same. If they want to go reach somewhere, then they have to pedal synchronously. So by working in tandem, I mean all these components need to work as a team together, and they need to relate to each other. So one thing that you need to remember as far as these 8 components is that the first 6 components are there for the national and subnational levels as well. So as far as our country is concerned, that subnational level might be considered the provincial level, or it might be the district level or the tehsil level. So that could be the national and subnational levels. But the 7th and 8th program, and I'd like to revise what I mean by the 7th and 8th core component. The 7th component was about the staffing, about the bed occupancy, and it was all about the enabling environment. The 8th component was about the infrastructure that we should have, the equipment that we should have, and the materials that we should have. So what I'm trying to say here is that among all these 8 components, the 7th and 8th component should be there at all healthcare facility levels, and lower than this is not acceptable. So, but the rest of the components, the first 6 components are there at the national and subnational levels, and all this is available in the IPC infection prevention and control booklet that's there, that's easily available on the internet. We'll give you the links to that also.